Thank you, Supervisor Cox. Thank you all for being here. As you have seen and will continue to see in the coming days, and you'll get more details on this from Dr. Wooten, our number of positive tests in San Diego County continue to rise. We expect this trend to continue. We expect it to not only continue, but as more testing is brought online, we expect it to accelerate in terms of our awareness in the coming days and coming weeks. While we're taking action to flatten the curve and slow the spread, we are simultaneously doing everything possible to increase the availability of our healthcare system in anticipation that as we get additional positive cases, there will be additional individuals who need healthcare services, and we want to do everything we can to ensure that those services are available. And so it is a two-pronged effort. I know there's been a lot of discussion about exactly what the future holds in terms of timelines, in particular on social distance requirements, the work restrictions, and others. The reality is at this point we still don't yet know how long we will continue on a trajectory or how severe the impacts will be on our healthcare system. And so there's nothing to indicate a change in posture here in San Diego County anytime in the immediate future, but we will continue to monitor and assess the situation on a daily basis and keep everyone apprised of that. Today, the San Diego County Board of Supervisors had a meeting, our first remote meeting. We took a number of actions in our regularly scheduled meeting. One, action brought forward by myself and Supervisor Gaspar providing protections to tenants, homeowners, and small businesses who have been affected by the COVID-19 pandemic. Particular protections for renters, both individual and commercial, that you cannot be evicted because of an economic impact related to COVID-19. We also had actions to provide similar protections to those who might be facing foreclosure. They will provide relief for up to 4 months without penalty, with the possibility that we can always come back and assess this as we move forward. They will go into effect immediately and remain in effect for now until May 31st. The action we took is similar to the actions the City of San Diego, City of Imperial Beach, and other jurisdictions have taken. Our action today will only apply to those in the unincorporated areas of San Diego County. We also voted to approve providing relief to the food and beverage industry and related small businesses impacted by COVID-19. This action was brought forward by Supervisors Desmond and Gaspar. This action defers health permit fees for food and beverage facilities that are impacted by the county public health order, limiting the operation of restaurants. It directed our CAO to seek additional state and federal funding to address the impacts being felt by the hospitality, food and beverage industry, and provides a path for the county to help the food service industry reopen after the public health order is lifted. We also took action on an item providing guidance on how county employees can be compensated during the pandemic, providing advanced sick hours to employees who are sick, ensure they have adequate sick time if needed, along with a host of input on other employee-related issues. Then we received a COVID-19 General Board update on the Emergency Operations Center, the federal quarantine, how the county monitors, update on the number of regional cases, along with a broad-based update on how we are responding, testing capacity, temporary lodging, sector outreach, public education campaigns, and others. And last, we directed $10 million in management reserves to be used for the COVID response activities. Those were COVID-related activities. We also had a series of consent items that just ensure our government continues to function and continues to operate in the way everyone would expect. In addition to the steps we took today to help the food and beverage and restaurant industries and to protect individuals facing foreclosure or eviction, I'm pleased to report that the COVID-19 Community Response Fund is continuing to grow. The community is continuing to step up. We are now at almost $6 million total raised from about 1,000 individuals, businesses, and foundations. To date, $950,000 has been granted out to individuals who are in need of help with food security, with rental or utility assistance, with income replacement or gap funding. For more information on this program, you can go to sdfoundation.org/COVID-19. The state of California also provides resources to help those who are being impacted, particularly those who are out of work. First, if you are unable to work because you have contracted COVID-19 or have been exposed to someone who has, you can file a state disability insurance claim. Second, if you can't work because you're caring for an ill or quarantined family member with COVID-19, you can file for paid family leave claim. Third, if your employer has reduced your hours or shut down operations due to COVID-19, you can file for unemployment insurance. This provides partial wage replacement with benefits to workers who lost their job or have had their hours reduced through no fault of their own. If you think you were misclassified and you receive a 1099, you may still be eligible for unemployment insurance, and you are encouraged to apply. For more information or to file a claim, you can visit edd.ca.gov. You can also call your your local state legislative office if you need help or assistance or clarification on those programs. I know my member of the Assembly has her office open remotely, and they are answering calls, and you can feel free to call their office at 619-338-8090. The federal government also provides resources to help small businesses and nonprofits through the Small Business Administration Economic Impact Disaster Loan Program. If you're interested in applying for these, you can go to sba.gov. So a series of actions designed to provide help and assistance to those who are being economically impacted. With that, I will turn it over to Dr. Wilma Wooten for our Public Health Officer's report.